The United Nations World Food Programme, the WFP, has warned of an impending famine in southern Madagascar. Some 1.35 million people have been left in need of emergency food and nutrition assistance by the ongoing drought there. The drought intensified from the start of the lean season in September, and WFP says that it's assisted 750,000 people through monthly food and cash distributions, but hundreds of thousands more are being pushed to the brink of famine. The UN Food Agency is seeking $75 million to cover emergency needs in the next few months.
The World Food Programme says persistent drought in southern Madagascar has left hundreds of thousands of people on the brink of famine and stoked acute malnutrition among children. The Ministry of Health data revealed that 16.5% of children under 5 now suffer from acute malnutrition, almost double the proportion 4 months ago. Amer Daoudi, Senior Director of WFP Operations globally, speaking from Antananarivo, Madagascar, said he had visited villages where people had resorted to eating locusts and leaves.
But what I witnessed yesterday, again with members of the diplomatic and international community as well as the government, is horrific images of starving children, malnourished, and not only the children, mothers, parents, and the population in the villages we visited. The situation is extremely worrisome, scary. They are on the periphery of famine, and these are images that I haven't seen for quite some time across the globe.
He says malnutrition has almost doubled to 16 from 9% in the 4 months to March 2021, following 5 consecutive years of drought, exacerbated this year by sandstorms and late rains.
The issue is no longer about how bad it is. It's extremely bad. Famine looms in southern Madagascar as communities witness an almost total disappearance of food sources, which has created a full-blown nutrition emergency. People have had to resort to desperate survival measures such as eating locusts, raw red cactus fruits, or wild leaves. At least 1.35 million people need emergency food and nutrition assistance and have been suffering from hunger since the start of the lean season last September.
The semi-arid conditions of southern Madagascar, combined with high levels of soil erosion, deforestation and unprecedented sandstorms, have turned arable land into wasteland across the region.
Shelley Thakral is World Food Programme Regional Communications Officer for Africa. And she joins us now to tell us a little bit more about the situation in southern Madagascar. Thank you so much indeed for joining us. Welcome to the programme.
Thank you.
We've just seen from that package there a story of a very desperate situation. What can you tell us about what you actually see on the ground and the lives of ordinary Madagascans?
Horrific images, eh? No, and it's beyond belief. Nobody wants to call any country, anybody's life being looming famine, brink of famine, periphery. As Amam also mentioned, it's a worsening situation. We started to raise the alarm bells 6 months ago, and it's people living on the edge. COVID-19 has obviously had a massive impact on communities in Madagascar, where people have migrated from their villages. And these are very remote, difficult, hard to get to villages. You in the south, which is the sort of epicenter of the issue. Amer and team and our nutrition team, they talk about, just taking 2 fingers and being able to wrap them around an adult's arm. So it's children and it's older people, it's grown-ups. And when you see these people in these images, it's swollen bellies, and you can see their ribs protruding. You talked about in your report about survival coping mechanisms of people having to eat, pondweed and locusts and raw cactus fruit and wild leaves. This is the brink of absolute deterioration, and we need to do life-saving work here and stop this spiraling out of control.
So that's where we are. I mean, we're talking about people dying of hunger.
We don't have mortality rates, and we're in the middle of doing what we call IPC, which is a classification of data. And often in these villages, when a member of the family dies, a child dies, or an elder or a member of a family, they're buried, and there perhaps a few records that are taken. So early next week, we hope to have a classification of data in terms of being able to record mortality rates. But every day we know, because we're on the ground, we're working in nutrition centres, we're working with people who need food. We're feeding out of 1.35 million, 750,000. It's only half rations. We do need money. We need money fast. We need money yesterday. But without that money, without that resources, people will slip closer to starvation and closer to famine.
The government of Madagascar, I guess, overstretched with so many things that they need to deal with. They just can't cope without the help that you are providing.
The government of Madagascar, we work very closely, but also remember that this island has been hit very hard by drought, by Sahelian-like sandstorms, which have covered what would be, now, planting season. Harvests are just ruined. We do our own assessments, and we know that food production in 2021 will be less than 40% of the last 5-year average. The climate effects, climate shocks, be it cyclones, drought, no rain, incredible dry arable land. This is something almost beyond people. We do need money. We need and the infrastructure, and even getting cargo and shipments of food into Madagascar is also a huge challenge. This is what the World Food Programme does incredibly well in terms of getting to people, having the logistics. But we're also overwhelmed by a pandemic and also other issues where we do need money in terms of being able to translate that resource, that money, that dollar, and being able to put food in people's mouths.
And I'm always mindful of children, and I guess that children, infants, particularly vulnerable, especially when we start talking about malnutrition.
And also, coming back to the pandemic, families have been forced to leave their rural villages and perhaps migrate to more urban areas. So children have left school. They may have been having. We also run school feeding programs. So the alarming rate of the situation for children under 5s is deteriorating, and especially in the southern districts, which we're talking about. And this has doubled over the last 4 months, which has increased from 9% to 16%, according to a very recent Ministry of Health survey. So again, this whole, the childhood of children who are foraging for food, with their parents, with their mothers, with their fathers, forced to eat locusts, but forced to eat whatever they can find. That's not nourishing. That's not going to help them survive.
Shelley, you talked about climate change, climate shocks, and we've talked about Madagascar many times over the years, and they almost have these seasonal challenges that they face. Looking into the future, I mean, it looks as if this is going to be a permanent operation there. Can anything be done to, I don't know, deal with the emergency and set up something more sustainable?
So what we are trying to do, beyond the food and nutritional assistance, we continue to monitor. We're always working with our sister agencies, with UNICEF, with the government, on what is happening on the ground. And that data that we can collect will enable us to monitor the evolution of the situation. Obviously, there are windows of opportunities. Now is now, and that's when it's most urgent, because we need to get food to people, we need to feed people. And again, we need to continue to sort of raise awareness. The world, of course, is facing massive socioeconomic crisis. There are problems in every corner and every crook and cranny of the globe, but we cannot and we should not let the people of Madagascar, we should not ignore them, and we need to give them the attention and the resources that they need today.
All right, so you're looking to raise, what, $75 million? How long will that last?
We will run out of food in July. We're looking for $74 million, $75 million for the next 6 months. We have very generous donors, and we're very, the World Food Programme works across the globe. We're very fortunate to work with incredible governments globally, the host government of Madagascar. But again, enough is not enough, and we do need this money in order to help people, to help those children. The images that you've seen, we need to reverse this trend. We need to make sure that there is sustainability, that there is development for children, and that there is a long-term future also for people.
All right, so hunger, a very clear and present danger, but coupled with COVID-19, we need nutrition for immunity. So this is another issue that's compounding a very difficult situation already.
That's right, and again, along with that is clean water, it's sanitation as well. Those basic access to health that we often probably in our daily lives take for granted. But that successive drought, climate change, it all compounds. Climate, it all compounds in terms of what's driving this hunger, which thousands, hundreds and thousands are experiencing right now in Madagascar, and it's sort of hampering their access to food, inability to be able to grow. These people are farmers, they're herders. People often say, but they're surrounded by water. What about fishing? But the south, where this is the epicenter, they're very far from water. So again, this is what we're dealing with in terms of just an inability to give them the crops and the harvest that they need to see them through the next planting season.
All right. I'm not quite sure what the terrain is like, but are you able to access people in the most rural areas?
We have an incredible team of people, field people, operationally, but it takes time. I mean, even getting to places in the Ambavombe district, traveling to different villages, even if you only have, a collection of 100 or 200 people that you need to meet at one nutrition center or one area, it can take you another 2 to 3 hours to drive on very poor roads, very dusty, very bumpy roads. So all of this does take time, and that's something that we're also very aware of with the current lockdown as well, that the Madagascan government has in place because of creeping and rising cases of COVID. So again, we have to do what we can as fast as we can, but obviously also limited by some of the challenges that are imposed on us by poor roads and poor infrastructure.
All right, perhaps as a final word out to potential donors and people who can help, what is your message to them?
I think the message is that this is the writing on the wall. We're coming to the world, and we're sort of we're seeing these images day after day, talking to people, mothers. Amir, my colleague who you heard in the report, talked about mothers selling cooking utensils, and that is rock bottom. When that people are just resorting to any measure because they need money. We need money, we need food, we need assistance, and we cannot and we should not fail these people.